All right, guys, it has happened yet again. A nurse has made an error that has resulted in the death of a patient. This time, quite a bit different than it was with RaDonda Vaught. This time, Yvette Hunter, the nurse, gave a 97-year-old patient, James Madison, a lethal dose of lorazepam. Lorazepam is a benzo that is used to help with anxiety. The problem here is the nurse did not have the order to give the medication. Now, when it comes to RaDonda Vaught, the outcome may be the same. Patients ended up dying. RaDonda Vaught had an order to give a medication, and RaDonda gave the wrong medication, however you want to call it, with the issues at hand with the Pyxis or whatever the issue may have been. RaDonda gave the wrong medication but had an order for a medication. In this case, Yvette Hunter had no order for a medication. Instead, wanted to cure a patient's anxiety, go ahead and calm them down, went on ahead and picked up someone else's lorazepam and gave it to the patient IV, resulting in their death. Not only that, but also there was no rapid response call, even though respiratory distress was picked up. And even the respiratory documentation or the respiratory machines that were there to alert people when stats had fallen down were turned off or silenced. This is a big deal. This is a real big deal. In my opinion, this is much more cut and dry than the RaDonda Vaught case. This was an intentional giving of medication. Now, although the death may have been an accident, this was an intentional giving of the wrong medication. And the fact that rapid response wasn't called when respiratory distress was noticed, that's a big deal. This looks very intentional, especially to a jury. Whereas RaDonda Vaught was found guilty, sort of led off with the best possible situation. This one I don't see going that way. I believe that Yvette Hunter is probably going to look at some time on this one. It was a medication that was for someone else, and then they gave it and then did not call anyone, didn't notify anyone. Also, the hospital in this case is also sort of compliant, whereas in the RaDonda Vaught case, the hospital was sort of non-compliant and pushed everything under the rug, which was an issue all to itself. This one is much more cut and dry. This nurse appears to have intentionally given this medication, although the death was probably an accident, intentionally gave the medication and silenced respiratory documentation, respiratory alerts to sort of make this patient not be as big of a nuisance, it appears. Kind of a big deal. Kind of a big deal. Yes, the death was probably an accident, but still, there's a lot of red flags. A lot of negligence went on with this one. A lot of terrible things happened in this one that resulted in the death of this patient. Kind of a big deal. Also, the doctor did not give the order for the lorazepam when the nurse asked for something to calm them down. The nurse did ask for an order to calm the patient down, and the doctor said no. The nurse went on ahead and did it anyways. Nurses cannot act independently. That's something that they cannot do. It happened here, and it ended in a fatality. It's quite unfortunate. However, if you like Nurses Making the News, there should be a playlist down below. Don't forget to like, share, and subscribe on that side. And there should be a video over here that YouTube thinks that you will like. Hope it helps. Thank you much.